we found that there is a bill that is in Parliament brought by a department that works with us, which is health. And that bill has a name that is tobacco. I can't read it. It's a tobacco control bill of 2022 that we are going to talk about today.
Really ditho tsa palamente tsa komiti ena ya tsa bophelo bo botle. Re ile ra fumana hore hona le seka molao kapa bill e tlisitsweng ke lefapha la tsa bophelo bo botle e mabapi le taolo ya ho tsuba. Jwale re tlile mona mabapi le bill eno hore e tlo tshohlwa ke setjhaba.
As daar is nog mense buite waarvoor ons wag, ons wil betyds begin. Ons wag vir stoele. Ons wil net sê as u te skaam voel om voor die mense te praat, kan u 'n geskrewe inset maak. Ons sal later die besonderhede en as daar lede is, ons praat vandag oor die wet op tabakbeheer van 2022.
The members of parliament who were in this committee before us, in the 6th administration, took this bill to 7 other provinces. Free State was one of them, and there's 2 other provinces where the bill has been taken by this new committee, that is Northern Cape and KwaZulu-Natal.
Komiti ya parlamente e bileng teng pele ho rona e ne leng botsamaisi bane ba botshelela bo fetileng e se ile ya thakgola mosebetsi wa ho ya setjhabeng mabapi le yona bili ena ile di provinseng tse supileng mothating wa jwale ho akga le dikarolo tse ding tsa province ena Vrystaat.
But in, okay, sorry.
Lede van die 6de administrasie het al na 7 provinsies gegaan met hierdie wetsontwerp, maar nog nie in KwaZulu-Natal nie.
In Northern Cape. Yeah.
En in Noord-Kaap, jammer.
So we also learned that even though Free State was visited, but they did 2 areas, and therefore to be uniform with other provinces where we had 3 meetings per province, we were then asked by Parliament to visit Free State for just 1 more other public hearing on this bill.
Re ile ra ithuta hore ka nako eo ho neng ho etetse provinseng ya Vrystaat ho ile ha uwa mabatoweng a mabedi fela jwale ya ba re nka qeto ya hore ho be teng tshwano le di province tse ding tse bang huwe mabatoweng a mararo ho tsona ke ka ho re tlileng le batoweng lena hore le Vrystaat le yona e fumane tshebetso e tshwanang.
Voorheen is 2 areas in die Vrystaat reeds besoek met hierdie wetsontwerp en nou hou ons 'n 3de openbare verhoor om in lyn te wees met die ander provinsies in die land wat al 3 vergaderings gehad het.
We have been informed as a portfolio committee that there has been some engagements with the community just to give them an understanding what this bill is all about. And your understanding, therefore, is going to make you to engage with us, having reflected or still reading the bill, to say, what are you saying as a community on this bill?
Re tsebisitswe re le komiti ena hore ho ile ha ba teng dikopano tse bang ho tsona ho ne ho tshetsethwa ditaba tse amanang le mosebetsi ona e rotletseng kwano e le ka sepheo sa hore le tle le be le lesedi la hore na ha se le tla kwano ke eng eo le tla e bua ka yona la ile hore sentse le filwe dipampiri tsena hore le imatlafatse ka tsona le tseba hore ka nako e le lokollwang le tla tseba hore na le bua ka eng.
Ons het met die portefeulje komitee geskakel om aan hulle te verduidelik presies waaroor hierdie wetgewing gaan sodat hulle dit mooi kan verstaan en dat hulle dit vir u kan kom verduidelik waaroor dit als handel.
Yeah. So for me as a chair is to just take less than 10 minutes to indicate and highlight this bill as to what actually it is seeking to do, and therefore engage with you on the mic there to give us your input.
Nna jwalo ka modulasetulo ha ka hore ke hlahise selelekela sa se ka molao kapa bili ena hore na e mabapi le eng. Mme ke tla nka metsotso e ka bang 10 fela ho etsa jwalo, ho etsetsa hore ha se ke qetile e be le lona le fumana monyetla wa hore re tlo e tshetsetsa mmoho hore na re bona jwang kaofela ho ya pele.
Dit is aan my opgedra om in minder as 10 minute presies vir u te vertel waaroor die wetgewing gaan en dan u insette aan te hoor daaroor.
The starting point is a Tobacco Act of 1993, which is what Dr. Nkosazana Dlamini Zuma, the first Minister of Health, was championing.
Seo re tla qala ka sona ke molao wa taolo ya ho tsuba hwa kwae wa 1993 o ileng wa thakgolwa ke letona la mehleng eo e neng e le Dr. Nkosazana Dlamini Zuma. Ke mosebetsi o e bang re mona ka ona hoba o ile wa thakgolwa kwana jwale re ntse re tswela pele ka ona.
Ons begin by die wet op tabak van 1993 wat hoofsaaklik gedryf is deur Dr. Nkosazana Dlamini Zuma.
That act has since been amended 3 times: 1999, 2007, and 2008.
Molao o ho fihlela ha jwale o se o hlomathisitswe ka makgetlo a mararo ka dilemo tseo tse seng di badile.
Die wet is 3 keer gewysig, onder andere in 1999, 2007 en weer in 2008.
Okay. Yeah, I'm not aware. At the time we started the meeting, we were to be welcomed by a leader from the municipality. At the time we started, there was no one yet. I don't know whether that is still the situation right now, but if there is someone who recognizes a leader from the municipality who was tasked to come and welcome us into this meeting, I will then wait to be informed.
Ha ke tsebe hantle hoba ha ne re thakgola mosebetsi ona re ne re lokela hore re amohelwe ke e mong wa bahlanka ba motse ona, empane ha re ne re qala mosebetsi o ne a le siyo le a le mong fela a teng. Mme jwale haeba o teng ya teng e le mo tsebang kae kae le ka re tsebisa ho etsetsa hore re mo kope hore a tle ka pele a tlo re amohela.
Ons het verreëlings geskakel met die leier van die munisipaliteit en as hier 'n lid is van die munisipaliteit wat hier is om ons te verwelkom, dan wag ek nou vir daardie inligting.
The Department of Health, in its own thinking, said instead of amending this act 4th time around, like I said, there was another amendment 1999, 2008, 2007, rather because there's been some fundamental issues that have come in from the industry, better they bring a new bill to be translated if it goes through into a new act.
Lefapha la tsa bophelo bo botle le ile la nka qeto ya hore molao ona wa tsamaiso kapa taolo ya ho tsujwa ha kwae o ske wa fetolwa kapa o ske wa hlomathiswa lekgetlo la bone ho fapana le ho etsa jwalo re ka mpa ra qala seka molao kapa bili e nngwe e ntjha eo e leng yona e tla re tataisa ho ya pele.
Die departement gesondheid het gesê dat in steede daarvan om die wette 4 keer te wysig, is daar eerder fundamentele kwessies wat ons moet verander en met inligting wat kom uit die industrie uit en daarom verg dit eerder 'n nuwe wet dan.
The industry, tobacco industry, has been working and they've been innovative, and therefore there are certain things that have come into the space that is worrying those who are for public health and therefore want to introduce this. Because at the time of Dr. Nkosazana Dlamini Zuma, we did not have something that looked like vaping or in those things where you stand here and then you smoke something from that far. Everybody smoking and then, so those are new things coming in from the industry, and therefore there is something therefore to bring into regulating those processes.
Industry ena ya tsa tlhahiso tsa kwae ka nako eo ha o ne ho thakgolwa molao ona dinakong tsa letona la mehleng eo e leng Nkosazana Zuma le ne le sobe le dikgatelopele kapa ditswelopele tse seng di le teng kajeno tse tshwanang le ntho e bitswang vaping e bang motho ha e sebedisa a itsuba mosi wa yona wa kunkela o tla le hohle mona o qetelle o so amme batho ba bangata empa o sebediswa ke motho a le mong ke ha ke ka ho jwale re tlamehang hore re qale ka bili e nngwe e tla tlisa diphethoho tse ding tse amanang le ditswelopele tse seng di le teng mehleng ya kajeno.
Die tabakindustrie is baie innoverend en die nuwe innoverings het baie nuwe bekommernisse by ons wakker gemaak. Onder openbare gesondheid voel dat onder andere met vaping dat daar nuwe regulerende prosesse moet ingebring word in die wet.
The full name of this bill is called Tobacco Products and Electronic Delivery System Control Bill. So there is a word control. It seeks more to regulate, improve control than to completely ban smoking or cigarette.
Lebitso la bili ena he ke leo le seng le badilo leo bang ka hare ho lona le na le lentswe le reng taolo e leng ntho e bontshang hore sepheo ha se hore ho fediswe ka hohle hohle taba ya ho tsujwa ha kwae empa ho hlokeha hore ho be le taolo e itseng ho tsubeng ha ka ho etsetsa hore batho ba se ke ba etsa fela ka boithatelo lo ba ke ha jwang.
Die titel van die wet, die wet op tabakprodukte en e-sigarette seker impliseer vir ons 'n hoër mate van beheer. Dit gaan hier oor beheer eerder as om te verbied.
Within the bigger picture of controlling and not banning, there are two other focus of the bill that seeks to ban, B-A-N, not to ban like fire, to remove it from existing, ban. Two.
Mantsweng ana a sebedisitsweng mona ho seka molao sena hona le taolo le phediso ka hohle hohle empa ne ha o bolele hore ho tla fediswa ka hohle hohle empa hona le dintlha tse ding tse bang di tlameha hore tsona gore di fediswe ka hohle hohle di se tsa hlola di etsahala.
Die fokus hier is om 'n groter prentjie raak te sien van beheer eerder as om dit te verban.
The bill seeks to ban having cigarettes or the tobacco products on vending machines in the malls, anywhere else. Because the understanding is that anybody who's got money, whether you're a 10-year-old or a 12-year-old, you can use that vending machine to dispense tobacco products. So there is a complete ban on vending machines all over the country to have tobacco products in them.
Bili ena e habile hore ho fediswe ka hohle hohle hore ho rekiswe kwae kapa disikarete metjhining e mona e bewang fela mo ebang motho ofe kapa ofe o na le bolokoloi ba hore a ka ya a ilo reka hoba ntho e ka qetella e susumeditse maemo a hore le bana ba banyenyane ba ka bang le dilemo tse 10 le bona ba qetelle ba ilo itekela sikarete ba ke motjhini fela o beuweng mono o sena motho a o laolang jwale eo ya metjhini eo yona e bang e rekisa kwae e tla fediswa ka hohle hohle.
Die wet praat van die verbanning van tabakprodukte uit alle verkoopsautomate of vending machines. Die risiko bestaan dat met verkoopsautomate die sigarette te koop aangebied word aan kinders.
The bill also seeks to ban availability of tobacco products on kiosks. When you go to certain malls and shops, there's a display there, whatever that is there. So it says it must not be displayed at the point of sale, but rather be available when you ask for it either underneath the table or somewhere else, but not to display it on the shops and every place of sale as it is currently the situation.
Ntho e nngwe e bang bele e habile hore e fedise ka hohle hohle ke dipampiri tse mona tse manehwang maboteng dibakeng tsena tse ho rekiswang sakarete ho tsona tse bontshang boteng ba sikarete tse bapatsang hore hona le sikarete e rekiswang mona jwale bile habile hore dipapatso tsa mofuta ono di fedise ho hang kwa yona e tla nne be teng e rekiswe motho o tla e fumana ka nako a batlang ho e reka e seng hore motho ha kena a ba santse a bona hore hona le dipapatso tse teng tsa thekiso ya kwaai.
Die wetsontwerp verband dan die beskikbaarheid van sigarette en tabakprodukte in kiosks, soos byvoorbeeld in winkelsentrums, en dit mag ook nie vertoon word in 'n winkel of by die verkoopsarea vertoon word nie. Jy moet daarvoor vra.
Yeah. Those are the two bans. I'll put the three which are not bans together. Then the members who are interpreting will do the three together. The bill advocates for plain packaging, that rather than it is glossy, looking nice, display, it must be a plain packaging. Two, it must have visible warnings that says, by the way, smoking is dangerous. Smoking, so those things must be visible, and the department thinks that if it is a plain packaging with the visibility of those writings, it could go a long way towards making people not to be attracted to this. The last one, so I've said the bill, therefore, while it does not ban tobacco, it is planning to decrease easy access to tobacco products.
Phediso e nngwe ya boraro ntho e bang bile habile hore e fediswe ka hohle hohle ke dipakete tse mona tsa di sigarete tse bang di batla di le majabajaba di kgahla mahlo a motho a di sheba jwale sepheo ke hore tshebahalo ya tsona e be tshebahalo e sa kgahleng mahlo mme ho tsona mono ho be ho ngolwe kotsi ya kwae hore na kwae e kotsi ha kae ha motho a itsuba. Ntho e nngwe hape e ho batlang hore fediswe ka hohle hohle ke hore kwae e fumanehe ha bobebe mo e rekiswang teng re batla hore re thatafatse mekgwa e bang kwae e tla fumaneha ka yona.
Daar is twee verbannings in plek. Die eerste is dat sigaretpakkies mag nie meer handelsmerke op hê en uitgeken kan word nie, en daar moet sigbare waarskuwings op die pakkies aangerig word wat mense ontmoedig om te rook, en dit kan mense dan en dit wil nie tabak verban nie, maar dit wil net maklike toegang tot tabakprodukte verbied.
There is information that per year in the world, 8 million people do die on tobacco-related illnesses.
Ditaba tseo re di fumanang ho tswa lefatshe ka bophara ke hore batho ba ka bang dimilione tse 8 ba ya shwa selemo le selemo ba shwa ka mafu a bakwang ke ho tsujwa ha kwae.
Dit word gereken dat daar so wat 8 miljoen mense per jaar sterf aan tabakverwante siektes.
Now, there's also some information that comes in through those who are doing scientific work that there's 1.2 million people in the world who have decided not to smoke, but they have been affected by the smoking that takes place around themselves.
Hona le lesedi le leng hape le ntseng le tswa hona maemong a lefatshe lohle hore hona le batho ba ka bang 1.2 million bao e bang le bona ke batho ba sa tsubing ho hang empa le bona ba angwa ke mafu ana a ho tsujwa ha kwae hobane dibaka tseo ba tsamayang ho tsona ba hahlamelwa ke mosi ona o bakwang ke batho bana ba tsubang kwae.
Inligting uit die wetenskap sê vir ons dat daar tans so wat 1.2 miljoen mense is wat nie rook nie, maar wat geaffekteer word deur ander mense se rook.
You know already now that in some places, in particular places, planes and airports, you don't smoke in particular areas. But there are people already encroaching into wherever they smoke. It is like a right to smoke and not a right for anyone not to wish to be having smoke on their faces. Because there's hardly a time when those, so there's going to be an expansion of where could people smoke in the light of this research work, to say there are other people who go past you and they are non-smokers. They get affected in the environment because they happen to be in the space that people are smoking at.
Hona le dibaka tse ding tse bang haufi jelo ho hang ho tsona jwalo ka dibaka tsa boemafofaneng esita le difofaneng ka botsona. Empa le ha o le jwalo hona le dibaka tsena he tse bang o dumelletso re utsuje ho tsona. Empa jwale di ama batho ba sa tsubing ba kana nako engwe motho le ha sa tsubi ha iphetela fela tikolohong eno mesi eno e bang sentse ikunkela mono ka lebaka la ho tsuja ya mo haslamela qetelle le yena a sa ameile hampe bophelong ba hae.
Ons weet reeds dat daar sekere plekke is waar ons glad nie rook nie, maar daar is egter indringers wat regmaak om hulle in ons omgewing te kom rook en hulle fokus op die reg om te rook eerder as mense se reg om nie te rook nie. En nie rokers word op die manier geaffekteer.
Kutswanetse unrooted this hang. Anyway, we are now at the stage where I'm going to open up for members of the community to indicate I support this bill that says this, I do not support this bill. We would want to hear that based on what actually has been given to you prior to us coming here and some of the things that I've shared with you, focusing on improving the public health of the citizens of our country.
Thank you very much, and thanks for the welcome. My name is Cedric Tlaku from Bochabelo, Ward 3. I am against this bill in its current form. I'm a scientist by profession. I hold a Master's of Science degree in public nutrition. Now, my comments focuses specifically on the preamble of the bill. Nicotine is incorrectly classified as a toxic substance. This statement needs to be corrected. Now, nicotine is a naturally occurring compound found in various plants, including tobacco. Nicotine is not toxic, nor is it carcinogenic. Now, the FDA, the IARC, and a public health body in Sweden have shown that its use is not associated with cancer or smoking-related diseases. What causes smoking-related diseases is the burning, therefore, of tobacco. Now, in 2021, Public Health England indicated that 4 out of 10 smokers and ex-smokers wrongly think nicotine causes most smoking-related cancers, when evidence shows that nicotine actually carries minimal risk of harm. Now, nicotine replacement therapies, which are approved by public health regulators worldwide, contain nicotine. If nicotine is toxic, why would regulators who are mandated to protect the health of the population approve a toxic substance? Now, the preamble should only state that nicotine is addictive. However, it is not a toxic substance. Thank you very much.
Just repeat for me, you have a master's in public what?
In public nutrition.
Program Director, thank you. My name is Patrick Lekgetla,
Branch Secretary of South African Communist Party.
Branch Secretary of South African Communist Party,
Fezile Pasholo branch in Jagersfontein. Chairperson, here's what we are here about.
I read and understood everything,
empa di na le di-loophole.
but they have loophole. There are some loopholes.
Ke ka hoo ke reng nna ha ke support bili ena.
That's why I'm saying that I'm not supporting this bill.
Modulasetulo o buile taba ya hore batho ba 8 million ba shwa ka baka la kwae.
Chairperson, you said that about 8 million people are dying because of tobacco-related illnesses.
Potso ke hore portfolio committee e kile ya etsa di-research tsa hore ho be le moriana o tla etsang batho ba tlohele kwae na.
The question is, has the portfolio committee conducted a research to find if there's a cure or medicine that can be used to deter people from using tobacco-related products?
Molao ona kaofela ona,
The whole of this bill,
na molao o tlo matlafatsa jwang hore bana ba molao le bona ba tsuba.
how is the law going to be enforced? Because even the law enforcement is smoking or using tobacco-related products.
Molao ona o bue ka di-worker paper.
What?
Worker paper, humble. Ke humble. Tsa ntse di bua.
Okay. This bill is not talking about Habli.
Ha o bue ka di-roll twak.
It's not talking about the roll talk.
Le sa ntse ke la bua.
What some people normally put in the mouth.
Ha o bue ka di-snake.
It's not talking about the snuff.
Ha o bue le ka di-drug.
It's not talking about drugs.
Portfolio committee, health department, le dumeletse matekwa a rekiswe.
Portfolio Committee of Health has allowed the sale of dacha or marijuana
Hore a etse sesepa le tse ding, empa matekwane ana a tsuba.
to make soap and other products, but this dacha is being smoked.
Modulasetulo, I'm worried ke ha ke bua ka matekwane.
Chairperson, I'm getting more worried when I speak about dacha
Le molao ona wa sikarete wa matlafatso.
and this law of cigarettes is being strengthened.
Potso ke hore portfolio committee e kofolela mang hore a tlo bula sikarete se entsweng ka matekwane.
The question is, the Portfolio Committee is assisting who to open a business or to?
Matekwane sikarete. Manufacturing ya sikarete e entsweng ka matekwane.
Or is assisting who to manufacture a cigarette made of dacha?
Portfolio committee ha e ne e shebana le ditaba tsena.
When the Portfolio Committee was busy analyzing or looking at this bill,
Ho na le unemployment rate e hodimo South Africa.
there's high unemployment rate in South Africa.
Ke batho ba bakae ba tlo lahlehelwa ke mosebetsi ka baka la ditaba tsena kaofela?
How many people are going to lose jobs because of the contents of this bill? Thank you very much.
Thank you for the opportunity, Honorable Director. I greet the Parliament members and I greet the members of the community. My name is Yatasa Putu. Okay. Thank you. My name is Yatasa Putu and I'm a medical practitioner. I've been practicing family medicine for the past 3 years. I reside in Madikhetha community where I'm aspiring to open a general practice. I stand in this position to say that the bill has some valid points, but currently I do stand to reject the bill because of some of the issues it did not address. So the main reason for rejecting the bill currently is that we as healthcare providers see patients who smoke on a daily basis. So, and the global adult tobacco survey that was conducted here in South Africa by the MRC has said that approximately about 42% of smokers have visited a healthcare provider and they were advised to cease or quit smoking. And then in September last year, the CDC reported that less than 1 in 10 adults who tried to quit smoking, they did fail. So it is true that we do like advice like smoking cessation. However, looking at the level of failure or the failure rate that we have seen, something that's been tried like replacement therapies, to which the patients, they do not always adhere to. We've seen some patients who have come back to see us in the healthcare facilities, both in the public and the private, and said that they have tried to use the non-combustibles forms or alternative forms, and they felt like they were more empowered over their addictions. And some, which is a very rare number, they've reported to have won against it. So I think it is a recommendation that maybe some of the resources be directed maybe towards the research and the studies that want to look at the alternatives, as we have seen the level of failure when we're talking about cessation. Or maybe we might look at the alternative methods maybe as another way maybe of tapering down in order to cease or in order to stop. I'll just make an example, even though not 100% related, maybe of a patient that we put on steroids. Maybe the patient was started on the 7.5 milligrams doses. We do not just stop them like abruptly. So what we normally do, maybe for a week or two, we taper that dosage to 5, and then for another week we taper it into 2, and then we cease giving that medication. So that example was to enforce maybe that alternative method should be looked at. As some of the studies have reported that non-combustibles, they give less harm. They are harmful, yes, but harm reduction or risk reduction strategies are also recognized by the World Health Organization. So thank you.
Thank you so much, Chairperson, and greetings to you and the committee. My name is Oshi Mamashila. I'm from Uchabelo, Ward 3. I'm a researcher by profession. I hold PhD, I hold Master of Science in Agricultural Economics and currently studying PhD in the same field. The Chairperson, the paragraph 2 of the preamble states that the bill calls for strong action to encourage existing users to quit. But then the main question is, what about those smokers who cannot quit because they are struggling and some of them actually they are addicted? So because of this, Chairperson, I would like to submit to you that I'm against the current bill in its current form. The recently published Cochrane report states that 6% of smokers successfully quit when using nicotine replacement therapies. But what about the remaining 94%? Maybe I think that at least let's just try other alternatives instead of just saying let's quit completely. The electronic nicotine delivery system are less harmful than cigarette and more effective than nicotine replacement therapies. That's a report by Cochrane that was published in the year 2023. The UK government has actively encouraged smokers to consider using e-cigarette as a way out of smoking, as it has recognized the role that science-based innovation play in reducing harm. To show the UK government support as part of their Swap to Stop scheme, they are encouraging smokers to swap to electronic nicotine delivery system, as it has been proven that they are less harm than the cigarette itself. So, Chairperson, I would like to say that us as a country, let's at least support the UK government with their decision, and then let's try to adopt what they're trying to adopt. Our government should assess the science of these novel products and follow such examples as the UK to ensure that we reach smoke-free status in our lifetime and improve public health for all South Africans. I thank you.
HIV sector under the Mangaung district. I'm in support of the bill because when you look at the health perspective, as a young person living with HIV, the consumption of tobacco substances is not only affecting the victims, but it's affecting everyone. Because if you are sitting next to the person who is smoking, smoking is inhaling. It means you are also inhaling. And it can impact your health in a negative way because you will be getting the diseases as a chronic person. And then it is also affecting us as people living with HIV because people who are under the influence of tobacco substances, if they are under the influence, they are stealing our ARVs. There will be a shortage of ARVs in our local facilities, and it is also affecting other people's life because people are going to default. And then again, the tobacco consumption is also increasing the crime in our communities because people, if they are under the influence, they commit crimes. And then I should also encourage the Parliament to also consider the rehab centers for the victims of tobacco consumptions, and it also should be for free because when you look at the tobacco consumptions, they are youth under unemployed. And lastly, what I would like to say is, when we look at our South African Constitution, everyone has the right to life. So if one is using or is under the influence of tobacco, it's affecting another person's life. Thank you.
Good afternoon, Chair, members of the Portfolio Committee of Health and the public at large. My name is Lorraine Govender, and I'm the National Manager for Health Programs at the Cancer Association of South Africa. We at the Cancer Association, as well as the volunteers, fully support this bill. Why? This bill is a strong piece of legislation that closes loopholes and addresses aspects not covered by the current tobacco law, such as proper regulation of novel products, including e-cigarettes. Now, members of the public, why is this bill so important to you as well as the government? It is here to save lives. It is here to reduce tobacco use. It is here to dissuade children from starting to use tobacco products as well as electronic delivery systems, which is the e-cigarettes and vapes. Now, we at the Cancer Association receive numerous complaints from the members of the public. Firstly, why are children as young as 11 buying vapes? Why is there such an increase in prevalence of e-cigarettes among our youth? Why are children, young children in primary school, able to buy loose cigarettes from people who pretend to be selling sweets and chocolates? Now, these are concerns that are definitely coming from the public, and we believe that this bill will definitely support our people. Now, we also want to say that how many of you are aware that it costs our country 42 billion a year to treat tobacco-related illnesses? Now, we know oncology treatment in our country is high. We've seen it on the news. We've heard lots of people talking about the fact that they can't access good oncology treatment. The waiting periods are long. And these are people that are not really involved in using tobacco products or any other products that can cause cancer. They are innocent people that are not able to access proper oncology treatment because of issues related to using alcohol, tobacco, and things that can really help prevent cancer. So we at the Cancer Association really believe that this current tobacco law will support people, will reduce lives, will save lives as well. So we also, I'm not sure if people are really aware of the number of people die early as a result of using tobacco products. And much of this information is available to you if you look at the Cancer Association's website. In South Africa, over 25,000 people die from tobacco-related illnesses each year. And this is not just something that I'm just saying. It's there, research is available. The GATT survey has also proved this. So thank you, Chair, for allowing me to share this with you today.